Talk about some sleep.
Yeah, happy November, right? At this recording time is November.
Happy November. Thanksgiving's around the corner.
We just had daylight savings happen, which kind of shifts sleep a little bit. And something that we've been talking with our patients a lot about is exactly that sleep around their mouth and their dental health. But it makes us go back to talking about sleep from a holistic standpoint instead of just talking about specifically, let's say, how your grinding is affecting your sleep, or your sleep is affected by your grinding, or they're somehow tied together. They're
related.
Yeah, they're waking up with sore. So we like to start the conversation with sleep, and I think a good place to start around sleep is ourselves and what we've done and what we're doing. And so what Mark and I do is we have wearables. I don't wear it during the day.
This is an Aura ring.
Yeah.
We have nothing to do with the company. We just both believe in the product.
It's a great thing. So what an Aura ring does, or any other sleep tracker, is it measures your sleep. It measures the metrics around you and your sleep. So what I like about the Aura ring is it measures your body temperature, your heart rate, your breathing,
heart rate variability,
your heart rate, and your HRV, your heart rate variability through the night,
and blood concentration levels.
Right, and so you're measuring your sleep, and of course it's not 100% accurate, but it's probably more than 80% accurate on a regular basis. So it's a good place to start to looking at your sleep. And I look at my sleep from one standpoint. I look at it from the moment I wake up. I look at it from what am I doing from the moment I wake up until the moment I actually try to sleep. Right?
It starts in the morning.
It starts in the morning.
It starts in the morning.
It doesn't start an hour or two before you go to sleep. It starts the entire day and what you do.
So start with the morning. Start with waking up. First thing we should do is, what do we always say? Hydrate.
We hydrate,
morning, right? Get some water in our system. Me personally, I limit my coffee intake to my first cup of coffee in the morning and don't have coffee throughout the day anymore.
I'm the same exact way.
With these rings, you start building some consistency in what you do throughout your life, and you could really fine-tune the variability and see what's working for you and what's keeping you up at night.
Right, and one thing that can keep you up at night, and the thing that I like that you said is hydrating early in the morning. Because if you hydrate late in the day, any hydration after 5 or 6 p.m. may wake you up during the night to have to use the bathroom, the restroom. So Mark and I both work on our hydration starting in the morning. My wife does. I like to drink 20 ounces of water with an electrolyte tablet first thing in the morning. It's the first thing I do every morning. I never miss that. It's a near calorie-free, no carbohydrate electrolyte tablet first thing in the morning. Our nerves and our body work off of a certain balance of sodium, potassium, magnesium, phosphate. There's a lot of different things our body works off of for our cells to work properly. So when you hydrate, you essentially are also diluting your blood. So you want to think about when you're hydrating yourself with an electrolyte tablet, you're making sure that water has the proper osmolarity or the same amount of osmolarity as your blood, and you're actually able to absorb more of it, and your cells and your neurons are able to function at the rate that they should.
How about the temperature of the water you're drinking in the morning?
Near room temperature.
Room temperature.
Always room temperature. Right. Yeah, because you can absorb it better. If you drink cold water, your body has to warm it up.
And you want to maintain this hydration
before you can absorb it.
Maintain this hydration throughout the day.
And that's the other thing about drinking things that have a different pH. So alkaline water or acidic water, like we talk about sparkling water a lot, your body can only absorb water at a certain pH. So before it gets into your blood and with your bloodstream, it has to maintain a very narrow pH for your cells to function. It's a very small window for proper homeostasis.
So to take on that, seltzer water is really not bad for you. It's in moderation, and when you take it in relationship to drinking
it's
water.
And the alkaline water isn't having a health benefit systemically. It's not making your body more alkaline. It can help with heartburn. It can help with your mouth with changing the acid from a local standpoint. But systemically speaking, alkaline water is not alkalining your body at all. So hydration is what we start with. And then Mark said it's great with caffeine. The things about caffeine, people have different levels of susceptibility. You talk with people who have a cup of coffee at dinner and go right to sleep. And those people genetically probably aren't very susceptible to caffeine. If I have caffeine at noon, I'll be laying awake at 10 o'clock because caffeine typically has, can have a 12-hour half-life in our body. And so the window when you have caffeine, have a stimulant is very, very important. And the studies show that you shouldn't have it first thing when you wake up. You shouldn't have it too close to bed. So probably the sweet spot is somewhere around an hour or two after you wake up.
After you hydrate, maybe a small breakfast. What else contributes to having a good sleep score, right?
Right.
Stimulation, right? Too much stimulation throughout the
mental
day.
stimulation. So that's the good thing to think about, right?
Your phone,
the last
your
few
computer,
hours.
Television on at bed. So you kind of want to almost meditate before you go to bed, right? Almost relax the mind as much as possible.
Yeah, the 2 hours. So I
2 hours leading up to going.
2 hours leading up to sleep. So I try to go to bed, try to be asleep by 9:30 every morning. I mean, every night. I wake up in the morning, in the 5 o'clock hour. So I'm thinking about my day at 7:30 p.m., what I start doing. And we'll get into the daily supplements that I take around that. But I supplement around 7 p.m. I take my night supplements. And so I'm looking at what am I thinking about for the time leading up to bed, and what am I exposing myself to? I talk with Janine, my wife, about the conversations that we have the last hour before we go to sleep. I don't want anything too heavy.
You don't want to be talking about your day as much.
I don't want anything too heavy.
You don't want to stimulate your nervous system.
Let's keep it light.
You want to not stimulate your central nervous system.
I always remember last year I was watching a hockey playoff game, right? I couldn't fall asleep for like an hour or two after that because of the light and the action, the intensity of it. Yeah. Just upregulated me so much that I couldn't fall asleep.
It's the same as after work. You go out for a dinner. Yeah. Maybe have a drink of alcohol.
Right. So let's talk about alcohol then for a minute. Oh. What have you found what does alcohol do to your sleep? What effect does it have?
Oh, it disturbs it completely. Even one drink, I notice. Yeah. So I really try to moderate my alcohol intake to one drink or none during the week. Also, the time of the day that you're out. If you're out and you're having alcohol at 9, 10 o'clock at night, then you're trying to get a good night's sleep, it's not going to work together. So what does alcohol do to
it's so strong to me too. Right. Although it's a depressant, it then makes our body upregulate other things. My heart rate increases.
Mm-hmm. Heart rate variability increases.
You get less of a variability, right? Because the nervous system is stimulated, so it's in a bad way.
It's just not consistent.
Right. So I notice that my body temperature raises when I drink alcohol. Yeah. It really disrupts my body's ability to reach a proper sleep pattern, and I get less deep sleep.
Interesting, though, even though it's not a stimulant, I'll find that my heart rate does increase from taking alcohol over the night. Yeah. The Aura Ring will give you your heart rate in the morning, and you could see your peaks, your highs, your lows, and the variability and the effect it has on your sleep.
The alcohol
waking up at night.
Such a profound effect on my sleep in a negative way that it has changed the way, aside from learning more about the negatives of alcohol, actually seeing it play out in a measurable device that you can wear is so significant. And that's why I like my patients who have a hard time with sleep, measure it and kind of wipe everything out that they're doing that can contribute negatively to sleep and start adding things back in.
Yeah. So the three takes for me is the alcohol, the coffee, and stimulating my mind at night. So no computers, no Instagram at night before I'm going to bed, no coffee, no alcohol. Yeah. And I find I'm much more alert in the morning.
The other two things that I do is my food intake, starting with the morning to the night. Is how I eat, right? You and I, we used to go,
we eat the same thing for lunch every day.
We do, yeah. And we, when we go out professionally,
we usually eat the same thing every day. But I know what you're going to say.
But we go out.
That kills us the next day.
Well, we don't go out late anymore.
Right, but if we do, that kills you the next day.
We don't go out late anymore.
Right. Try to get that dinner in by 6 o'clock.
Especially if it's a school night for us. We don't go out late. We don't eat late. So I make sure that I'm finished consuming food. My target, as I said, I try to be asleep by 9:30. The latest every night is 6 p.m. I try to finish consuming all calories by 6 p.m. every day, because you want to have a 3-hour window of when you eat your last calorie until you go to sleep.
Because you're waking up at 5 o'clock in the morning.
The best thing I've heard about sleep is you want to go to sleep hungry. That's how you'll get your best sleep.
Yeah, interesting.
Right, we have patients who snack at night, who eat something, who eat late dinner. Around New York City, people work longer hours than they should because they have to. It's cultural. It's a thing. They're eating dinners late. I have friends who have kids that put their kids to sleep and then have dinner with their spouse at 9 o'clock at night because they want that time together. Yeah. It has to be destroying your sleep. So if you drink alcohol and eat close to bed, it's over. It's over. Yeah. It's over. Yeah. And the other thing that I'm doing is I'm supplementing before sleep. I like to supplement for sleep.
So you supplement at night, right, before you go to bed?
Right. There's supplements I take in the morning, throughout the day, and at night. So you and I like to
I've been consistent with the magnesium at night. I know you like to take it in the morning also. What's the benefit?
I take different forms of magnesium. We're all deficient in magnesium, and there's a couple different forms of magnesium you can supplement with. So I'm supplementing with one form in the morning and a different form at night. The form that I do at night is magnesium L3 and 8.
Which is
brand name is Magtine. Yeah,
calm the nervous system.
It calms the nervous system. It promotes brain health, and it's been found in studies to have an effect to help sleep patterns. So Magtine is the brand name of it. They're the only ones that can make it. They have it's a great supplement. The other thing I'm playing around with right now is ashwagandha, which is really interesting. I'm playing around with that. Took it last night. I've been taking it for a few nights and then not a few nights and seeing how it works. I seem to like that supplement. It really calms and. It's an herbal supplement, of course, so it's a natural occurring thing. So it's really, I find it's pretty nice.
In the morning, we've been on the same page with our vitamins in the powder form.
Correct. Yeah, we like AG1, athletic greens. I like that supplement very much. Has probiotics in it.
It's very easy to take because it's in a powdered form. You mix it with your first hydration if you want with the water in the morning.
And then you're hydrating more because I'm taking with 12 ounces. 12 ounces with that, right?
Where I was taking physical vitamins prior to this.
And how much do you probably not drink?
Harder to swallow. You're not drinking as much water. You're just drinking enough water for the vitamins to go down.
I noticed that when I take pill form vitamins, I played around with a few different things from, pure encapsulations have some daily vitamins. So I played around with that. I've noticed that my urine is a much different experience.
Because they're going right through your system. A lot of them
have to think
right?
so.
There are some good ones, but a lot of them are going right through.
I have to think that you're not absorbing as much.
Especially the calcium.
You're not processing it over time as much. And you can also do some glycine at night. Glycine has some really good literature around sleep. And I the thing is about I'm hydrating early on in the day, so I'm taking that with water, but I'm trying not to take too much water. I'm trying not to take too much water. And the other thing that we do is the room temperature. I make sure my room temperature is low. My room temperature last night was 65 degrees.
Yeah, I like it a little colder.
Save money on heat, but you spend more money in the summer on air.
But go back with sleeping. I mean, you can do everything right and not drink coffee, not have alcohol, go to bed at a reasonable hour, but you can still have breathing issues, right? You're not getting enough air coming through, which can affect it. That's going to lead us into
now we're going into a different subset of things,
sleep apnea type of thing, which could lead into bruxism and grinding and clenching your teeth. Yeah. So that's a great segue. That's the airflow.
The great segue to go into where we started with why we talk about this with patients. Right. We have a ton of patients who come in who have symptoms of grinding, pain in their jaw, pain in their muscles, and they're waking themselves up at night, or they wake up in the morning, pain, and they're sore. So we start the conversation with your sleep hygiene.
How you sleeping at night?
Your sleep hygiene.
The first thing I'll ask a patient.
It's the first thing we talk about.
How was your night's sleep?
And,
Are you up at night?
We have this conversation that we just had in the chair with them about the things that you want to look for, from supplements to stimulation to coffee to your actual environment and what you're doing before sleep. We go through that with them, and now we can go through, well, okay, I've done a lot of that. I think the thing that with bruxism and grinding, the stimulants, right? Stimulants is this thing we got to start around.
Stimulate
either
the
your brain,
system, right,
in your brain, or taking some type of caffeine throughout the day that up, right, or there's medication. So what is grinding? What is bruxism? Bruxism is grinding your teeth.
Grinding your teeth. Right. It's usually an involuntary action, right? Sometimes we're doing it when we're sleeping. It's the parasympathetic system. It's the nerve innervations to our masseter muscles. You can have a bad bite, and your bite can be off, which could force you to grind a little bit also.
Right.
Where orthodontics comes into play. But the key, what everybody's talking about now, is airway. If there's not enough airflow, that's another symptom that can cause you to grind your teeth and clench your teeth a little bit more. You can be doing everything right, not having alcohol, not having coffee, but still not getting enough air, and that's keeping you up at night.
Your jaw starts moving around.
First thing I'll ask a patient is, are you snoring at night? Ask your spouse or your partner, are you waking up at night? That's a whole different ballgame getting into sleep apnea.
Right, because the problem with that for us is there's two completely different treatments, right? If you're grinding because of your nervous system is upregulated, or
what do we do for that?
Like you said, that there's some bite issues you're trying to grind around, or it's medication induced. That's a night guard that we make. We'll talk about that in a minute.
Right.
Where if you have a sleep apnea issue where the volume of air getting into your lungs through your body, your oxygen is lower than it should be, then you need to increase the volume of air you're getting either through a CPAP or a sleep apnea device that protrudes your jaw. And the problem with this is a mouth guard will make that worse.
Yes.
And a sleep apnea appliance or a CPAP will not help the grinding or bruxing necessarily. It'll protect your teeth. But you're still going to be functionally grinding and clenching into it. So we have these two problems that present to us in a similar fashion, and trying to diagnose that and figure out. So one thing I ask patients is if you're sleeping in a room with somebody,
monitor your sleep.
Ask them, when you're sleeping, what are you doing? What is your sleeping like?
Do you hear them grinding?
I always get the same reply.
Do you hear them snore?
They're like, my husband is passed out. He doesn't know what I'm doing when I'm sleeping, right? Everyone says that. It's like, do you look at your wife while she's sleeping?
No. I'm this way, she's this way.
Leo's in between, right?
But interesting though, we do both know if one of us is up. Usually does wake the other one up.
Yes.
So I'll agree with that.
You can hear someone grinding by tapping their teeth. You can hear that if you're sleeping next to someone who grinds and clenches. And also apnea is quite scary to sleep next to someone with apnea, right?
So the difference how we treat both, where Bruxism, clenching, will make an appliance, and we get into different types of appliance, which covers...
Go into it.
Well, the Bruxism appliance will cover one arch. It's usually made on the upper jaw. We like to use a hard appliance, not one of those soft ones that you can get in the pharmacy that kind of give you a tendency to clench into them more. It feels good clenching into a soft piece of plastic.
How many teeth does it cover?
It's going to cover the full upper arch.
All of your teeth.
All of your teeth.
Yeah.
If you're not covering all the teeth, you can get some movement and eruption from the teeth that are not covered.
Right, so talk about that. There's a thing called an NTI appliance. It's these little things that cover...
just covers the front two teeth.
What is the purpose of that?
So it's an anterior deprogrammer to disclude the teeth, to relax the muscles.
How
only touching in the front. You should only be wearing that for a couple of days.
Correct.
Then move into a full appliance.
Yeah. We call those rescue appliances.
Yes. Right. I mean, quick, patient comes in, you don't have the time to make them appliance, although with digital printing these days,
we're getting better at it.
Get appliance done in a day or two. But you don't want to send it to the lab and get a patient back a week later, so you'll make a small anterior deprogrammer that'll cover the front teeth, only the front two teeth or front four teeth, and to separate the back teeth to allow the muscles to relax.
Right.
So it's a diagnostic tool to relax the muscles and then move them into a different type of appliance.
A more full mouth appliance.
Full mouth covering all the upper teeth.
I had a patient who had terrible bruxism, terrible clenching, and her dentist made her an NTI appliance. She wore that because it helped. That's it. And she wore it because it helped. She presented to me, and only her posterior teeth were touching. Her molars, only her molars were touching.
So it changed.
Only her molars touching. So now she then started going to the oral surgeon to get Botox because of her bite changed.
The muscles adapted.
She could only adjust. She was clenching during the day because when your old back teeth only touch, you can exert more force because of the class 3 lever of her mouth. And so now she's in a pattern. Every 3 months she's getting Botox. Every 3 months. So what she did is she went through Invisalign treatment, and we were able to intrude her molars and adjust her bite to having a proper balanced bite. She hasn't needed Botox since, and
so when you
and she said she changed my life.
Botox
I changed her life.
Really only treating the pain.
Right. So it's different, right? So one way we treat, and the most common way we treat grinding and bruxism, if you can't downregulate your system, or if you're still doing it and your life doesn't, right? There's traders and people on Wall Street, people with a lot of children in a modern world, stress, and they're having a hard time removing that. We make a night guard for them. It helps to relax the system and protect their teeth.
Correct.
Some people develop their masseters so much that a night guard alone doesn't help, or they're in such a bad pattern that we need to just kind of snap it, right? You hurt yourself, you hurt your knee, you get a cortisone injection. You almost think of it like that. You need something a little stronger to help down-regulate it to break the pattern, and that's when we'll refer someone to a neurosurgeon, a dermatologist, or a pain management person to do Botox.
Or a combination with maybe some NSAIDs, anti-inflammatories for the muscles also.
Right, so there's some really classic things you can Google. If you Google Botox in masseter muscles before and afters, you'll see amazing pictures. I know Jeannie, my wife, always talked about Terry. What's the woman's name? The skinny margarita girl, whatever. Bethany Frankel. So she. Well, it's classic. It's famous. She
would see her masseters.
You know how John McCain had these huge masseters?
Yeah.
Right? From poor guy was through horrible stuff, had PTSD, clenching. She had these huge masseters. So she's like a really famous person. If you Google like before and after Bethany Frankel TMJ Botox, she like her face is overdeveloped, and then she looks balanced. Changed completely. Yeah. Changed completely. And with that, you also want to make sure you don't do too much of it, because if you go too much, typically you get your temporalis will get sunken in. You will underdevelop your muscles and you'll get sunken in, and it's a negative look. So you have to really want to make sure you work with the right person for that.
Don't you notice that as soon as they walk into the chair, you can tell who's a clencher, who's a grind, and some people have no symptoms with it. Right?
It's like most people have no symptoms. They're taking it out of their teeth. They're taking it out of their teeth, and the problem with grinding and clenching without being treated is you wear down your teeth. Aside from the observational symptoms of you're in pain, you usually break your teeth. And so what do you notice in patients who grind and clench for their life? We notice that they're
fracturing teeth.
Yeah. We've had patients split their teeth in half from grinding and clenching.
Yeah. Even doing dentistry on them, it doesn't last as long as it would.
Yeah, things break down.
It breaks down a lot quicker.
It's like driving a car two different ways. Yeah. Right? Driving it the speed limit conservatively the right way versus haphazardly off-roading it. It's the same car will break down faster if you drive it crazily.
Lips together, teeth apart. Your teeth should only be touching when you're swallowing and when you're chewing. Yeah. If you're resting on your teeth all day, it's no good for your teeth. It's no good for your muscles. Something's got to give.
Tongue position is very important.
Sometimes it's both. Tongue position is important also. Yeah. Rest your tongue upwards behind your anterior teeth and close your lips, leaving your teeth separated.
We have patients practice that throughout the day. Yeah. You're walking around at your desk. I practice when I'm working on patients.
Orthodontics are preaching it. Well, orthodontics now is big, looking into sleep apnea now.
On young
trying
children.
To catch it on young children before it becomes a problem when they're adults. Trying to expand the arch as a child instead of taking out teeth and making room that way. You want to expand the arches and make more room for the teeth.
You know, the other thing I've done with patients, and I know you do it too sometimes, that get into a really bad place, that do not want to do Botox, and where they have a nightcap or not, is intermittently taking muscle relaxers to sleep.
Yeah, we were talking about medication. Yeah.
So
I'm not a big fan of that, but it does work.
It does work for the right person, for the right time, right? Because there are medications that upregulate the system and cause grinding.
It's like a Flexerol.
Flexerol is my go-to.
Flexerol is my go-to. Do you like to piggyback that with an anti-inflammatory?
I'm not a big NSAID person for most things.
Does it affect on your system?
Yeah, the systemic effects. I try to stay away from that. I mean, of course, it works for it's a good medication for a lot of things, but if we can avoid it, we do that. Another medication that people take, that's something to be a little more cautious of, is Klonopin. Yeah, it's an anti-anxiety and a muscle relaxer. It's a great medication for that.
And diazepam is another one, which is a muscle relaxant. But Flexerol is usually the go-to, and I prescribe for that.
And the type of person you identify yourself as is going to have a profound effect in your overall health, your mental, your physical health, your systemic health, your emotional health.
There's a fine connection between your dental health and your systemic health.
Right. So with grinding and bruxism and sleep in general, it's about stress management, your behavior management, the things you're exposing yourself to, the thoughts you're having, how you're eating, your caffeine intake, how you're hydrated. What am I leaving out?
You did mention stress, and the Aura Ring will give you a little bit of detail on your day of how much stress. I didn't include that, but that's one of the factors that's going to keep you up at night, is stress also.
If you have any questions about anything we spoke about, from the things that we wear to the things that we do and take and the supplements, please let us know. Shoot us an email. We'll provide it in our email to our patients, what we do around this. But also, if there's some more information that you want, please let us know, because we're pretty passionate about this for ourselves and our loved ones.
Or different topics that we can address going forward. Anything that's on your mind related to your health, your dental health, that you'd love to address.
Turkey doesn't make you tired. Tryptophan in turkey does not make you tired.
That's not true.
If it is, not enough.
Is that what you're saying?
There's not enough tryptophan in turkey to make you tired.
Okay.
You just ate too much.
No, it's not true that you get tired from it.
Correct. It's not true that you get tired.
It's indulgent on too much.
Yes, of course.
It's not the turkey.
All right, great. Wish you all well.
Thank you.
See ya.
I'll see you next month.
Bye.